Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about the next step of the Gibson Method. So with the Gibson Method, we actually are talking about the different visits that happen to help you understand your peripheral neuropathy, help you manage the symptoms, help you control the damage that's happening from the disease processes, and ultimately help you to thrive or live an extraordinary life even with peripheral neuropathy. So in visit 3, there's a couple different things that actually happen. One, we typically will do another neuropathy test to evaluate if there's been any changes or any things that are happening with the addition of vitamins or some of these other things that are done over visit 1 and 2. We review the nerve biopsy. As you remember, we took an epidermal nerve fiber biopsy of both legs. We got the results. We determined whether you have a small fiber neuropathy based on the results that are seen in this. We review the nerve conduction velocity test to determine if you have a large fiber neuropathy. So now we know, do you have an autonomic neuropathy? Because that was done in visit 2. You'll find out if they have a small fiber neuropathy because that was done through the biopsy that was done in 2 as we review it in number 3. And through the nerve conduction velocity test, we can determine if you have a large fiber neuropathy. So basically, we have 3 of the 4 types of neuropathy that are evaluated and determined at this point. We review the urine results to determine if you have a toxic neuropathy. And then we actually say, okay, now we're going to do some very important pieces of the puzzle to, one, prevent additional disease process or damages, but also to evaluate and give you some resources that are very important with peripheral neuropathy. One is we evaluate for balance. We actually do what's called a tug test, a timed up and go test. We actually evaluate to see how good your balance is and determine if you are at high risk for falls or if you're at no risk for falls or somewhere in between. The advantage of that is we can actually say, okay, there's some things we can do to strengthen and prevent falls. We do a biomechanical exam. So we actually do a gait analysis and watch you walk and determine if there are things that can be done through orthotics or specialized inserts that can, one, prevent problems from the peripheral neuropathy, but also help you so you can actually function better with less pain, less discomfort, and less deformity. We do some pressure and temperature mapping to determine if there's areas of high risk for ulceration or wounds, so we can prevent those while we're continuing to work on improving your peripheral neuropathy. And then we look at any other possible problems that could be related to this. A lot of times at this time, we can actually initiate some of the treatments. So we can say, okay, we can talk to you again about the Calmare treatment. We can talk to you again about orthomolecular treatments with vitamins or nutrients that are necessary. We can talk to you about MLS laser or neurogenics treatments, depending on what types of neuropathy that you have. And we can start to initiate a more controlled exercise program, again, with the understanding that we know if you're at risk for falls. We know biomechanically what's going on, and possibly, if necessary, we can actually put you into a specialized orthotic or insert at this time as well. And then we start the process, the next step, where we say, okay, are there nutritional things that we should be doing? Are there meditation or relaxation techniques that should be utilized? And we also send you off to say, okay, let's confirm that you don't have any prediabetes. Let's confirm that you don't have any genetic causes of your peripheral neuropathy. And let's evaluate to see if there's any circulation causes of your peripheral neuropathy. So as you can see, between visits 2 and visits 3, there is a large amount of tests that are done and a large amount of information that is received. So we can actually truly determine if you have certain types of peripheral neuropathy, so we can actually work on giving you the tools you need to function without limitations. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 47, the Gibson Method, visit number 3.